Today we're going to explain you about we do have a special kit we call as a oral sensor integration kit, and we are going to know which things we have with us. But before I'm going to explain you about what is OSIT kit, that is oral sensor integration kit, we should understand about what is oral sensor integration therapy and which candidate, like what are the candidates for oral sensor integration therapy. So those who are having problem with communication disorders, जो बोल नहीं पा रहे हैं, जो मतलब स्पीच इनका डेवलप नहीं हुआ है, या जिनकी मसल्स में वीकनेस है, लाइक अफेजिया, डिजार्थिया, cerebral palsy, autism, mental retardation, and there are many different types of communication disorder. Those are acquired, neurological and developmental. So जब हम बोल रहे हैं कि neurological, acquired, developmental, so these are the different. Neurological means if something is happening after the learned language, like we have a two type of losses, we have a prelingual and the postlingual losses. So oral sensory integration tools can help you in both cases, like as a prelingual means भाषा के विकास होने से पहले का, और postlingual भाषा के विकास होने के बाद का. So we should understand what is pre and postlingual issues with the speech, language and communication. So speech, language and communication, these are the three things which we should always understand before we're going to proceed further. So for that, how we develop language. Language can develop through the environmental exposure as well as proper exposure, experience and learning. So we can say the language is a learning behavior, but speech is a combination of their four systems we do have. We have a respiration, phonation, articulation, resonation, and regulation is the system which cover the entire four processes. Like respiration is the production of air, phonation is the air is developing with the voice, and articulation we are using the articulators, and then we can use these articulators for the speech production. And articulators, basically we have a different types of articulators. We have a active articulators and we have a passive articulators. So we should understand everything in detail. But before I'm going to in detail, I'll explain you about what is OSIT kit and what things we do have inside the box. So generally, when you search in our website, we have a speech gears, and you just search with it, then you will directly log into our website. In our website, we do have a different tools, like we have a spatial kit, we have a speech kit, and we have a sensory kit. So this such kind of a segregation also we are available. Along with that, we do have a different types of tools, like we have a tongue depressors, we have a many language development materials, we have a flashcards, we have MyTab, we have stacking blocks, and many more things we have in our clinics. Along with it, we have Wonder Putty, which is very, very good for development of the both fine and motor skills. Gross and fine motor skills we can develop with the Wonder Putty. Apart from that, we do have a horn kit which we use for development, voice development, production of voices, and we do have many things. But today I'm going to explain you in detail about oral sensory integration kit. So what is oral sensory integration therapy? So it's a therapy which is based on the multi-sensory approach. Now I'll explain about what is multisensory, because our speech is a combination of both motor and speech, is a sensory and motor. Sensory integration therapy kit and what things we covered under the oral sensory integration therapy. So see, we have a procedure, but before I'm going to start, I'll explain you. We do have a two type of kit that you can see here. I do have a red color one and I do have a yellow color one. So this is a spatial kit, and this is yellow is belongs to a soft. So like when I'm going to start with any dysarthria patient or any autistic kids, so that time I have to explain you, like this is the yellow, it's a soft one, then this oro-tube we have, this is a red one. So now we are going to, I'll explain you about each tools and how to use it, and how we can use practically in our clinical practice. So basically, if you see here, this is the oro-tube, it's mentioned here. So the name is mentioned here. oro-tube में यहाँ पे तीन अलग अलग sides है. यहाँ पे एक ये long side है, यहाँ पे small side है, और यहाँ पे एक बड़ा side है. So when you are using it, you will feel it. This side is little softer, This side is little harder and this is the hardest. So how to use it? And you see the dimension of this rings are also different. We have a big ring and we have a small ring, and there's a soft one. So now what we have to do it with this oro-tube, we have to just first you have to just hold this way, and this long process should go inside your teeth. Like we have a wisdom tooth, so before the wisdom tooth, because we have a third molar, so you have to use the third molar, and then you have to put this tube like this. And gradually you have to go inside. So wherever you're using oro-tube, you always keep a bowl of water, so then you can dip in inside and then you can utilize it. And this way. This is the way how to use this. Now the same thing you have to do with the other side. Same way we can do with the soft oro-tube as well. So we have a total four types of oro-tube. So before choosing it, you should understand these things we have to, according to the need of the child or according to need of the patient. So it is not mandatory that we are using with only kids. We can use with, there is no age criteria. So we can use this oro-tube with dysarthria, aphasia, apraxia of speech, oral sensory integration.